Hi there, you are welcome to my YouTube channel. My name is Kofi Bohyeba. On today's episode of Did You Know, we'll be talking about insomnia. Did you know chronic insomnia can increase the likelihood of some serious diseases like heart attack and stroke? Sit tight, relax, as I explain everything to you from the causes to the prevention. Let's get this video started. You're welcome back. Insomnia is a sleep disorder in which you have a trouble falling asleep and or staying asleep. This condition can be short-term or can last for a very long time. It may also come and go. Acute insomnia lasts from one night to a few weeks, and chronic insomnia happens at least 3 nights in a week for 3 months or more. Let's look at the types of insomnia. Primary insomnia is when your sleep problems aren't linked to any other health condition or problem. Secondary insomnia is when you have a trouble sleeping because of health conditions like asthma, depression, arthritis, cancer, heartburns, pain, medication, or any other substance use like alcohol, tobacco, and cocaine. There is also sleep onset insomnia when you have a trouble getting to sleep. Sleep maintenance insomnia when you have trouble staying asleep throughout the night or you wake up too early. And also missed insomnia when you have trouble falling asleep and also staying asleep throughout the night. Now let's go through some of the primary causes of insomnia. Stress is a major contributing factor to insomnia. Stress related to big life problems like job loss or change, death of a loved one, divorce, or moving to a new place. Things around us could also be a contributing factor, like noise, light, and temperature. Changes to your sleep schedule, like jet lag or a new shift at work, or bad habits you have picked when you had sleep problems, could also contribute as well. Your genes. Research has found that there is a tendency for insomnia which may return or run through families. Let's look at the secondary causes of insomnia. Mental issues like depression and anxiety could be a contributing factor. Medication for cold, allergies, depression, high blood pressure, and asthma could also contribute as well. Pain or discomfort at night could also be a factor. Caffeine, tobacco, or alcohol use as well as the use of illicit drugs could also influence your sleep cycle. Hyperthyroidism and other endocrine problems, other sleep disorders like sleep apnea and restless leg syndrome. Pregnancy and other forms of dementia could also be a contributing factor. Let's look at insomnia risk factors. Insomnia affects women more than men and older people more than younger people. Young and middle-aged African Americans also have a higher risk of insomnia. Insomnia symptoms include sleepiness during the day, fatigue, grumpiness, and problems with concentration or memory. Insomnia diagnosis. Your doctor will do a physical exam and ask about your medical history or sleep cycle history. They might tell you to keep a sleep diary for a week or 2. Keep track of your sleep patterns and how you feel during the day. They may talk to your bed partner about how much you sleep or how well you are sleeping. You might also have special tests at a sleep center. Insomnia treatment. Acute insomnia may not need treatment. If it's hard for you to do everyday activities because you're tired, your doctor may prescribe sleeping pills for a short time. Medicines that work quickly but briefly can help you avoid problems like drowsiness the next day. Don't use overtime counter sleeping pills for insomnia. They might have side effects and they might tend to work less over a period of time. For chronic insomnia, you will need treatment for the conditions or other health problems for keeping you awake. Your doctor might also suggest behavioral therapy. This can help you change the things you do that might make the insomnia worse and learn what you can do to promote your sleep. insomnia complications. Our bodies and brains need sleep so they can repair themselves. It's also crucial for learning and keeping memories. If insomnia is keeping you awake, you could have a higher risk of health problems like high blood pressure, obesity, and depression. A higher risk of falling if you are an older woman. Trouble focusing, anxiety, grumpiness, and slow reaction time that might lead to a car crash. Now, let's pay a close attention to the most important part of today's presentation, that's insomnia prevention. Good sleep habits, also called a sleep hygiene, can help you beat insomnia. Here are some of my very important tips. Number 1. Go to sleep at the same time each night and get up at the same time each morning. Try not to take any naps during the day because they may also make you less sleepy at night. Point 2. Don't use phones or e-books before bed. Their lights can make it harder for you to sleep at night. Point 3. Avoid caffeine, nicotine, and alcohol late in the day. Caffeine and nicotine are stimulants and they can keep you from falling asleep. Alcohol can make you wake up in the middle of the night and hurt your sleep quality. Point 4. Get regular exercise. Try not to work out close to bedtime because it may make it hard for you to fall asleep. Experts suggest that exercising at least 3 to 4 hours before time is the most recommended. Point 5. Don't eat a heavy meal late in the day, but a light snack before bedtime may help you to sleep. Point 6. Make your bedroom comfortable, dark, quiet, and not too warm or too cold. If light is a problem, use a sleeping mask. If noise is also the problem, try earplugs, a fan, or a white noise machine. Point 7. Follow a routine to relax before bed. Read a book, listen to music, or take a bath. Point 8. Don't use your bed for anything other than sleep and/or sex. Point 9. If you can't fall asleep or aren't drowsy, get up and do something calming like reading until you fall asleep or watch a television. To the last point, if you tend to lie awake and worry about things, make a to-do list before you go to bed. This may help you put your concerns aside for the night. Thank you for riding with me to the end of this presentation, and I'm most appreciative of your subscription. If you haven't subscribed to my YouTube channel yet, please do well to subscribe to the channel now. Thank you for doing so. I come your way every week with amazing content on education, health, entertainment, and more. Do well to share this video to your family, friends, and co-workers, and urge them to come and subscribe to the channel. Till we meet again, take a very good care of yourself. Remember, you can also make a difference, and don't ever forget, Kofi loves you. Peace out.